Well, good afternoon. As promised, we want to come back and provide an update for you. Since we last met on Friday, there's not been much sleep. Your representatives of the city have been working around the clock, and we want to address some issues on today. I'm Mayor Anthony Williams. Following me, Judge Bowles will say some things from a county perspective. He'll be followed by City Manager Robert Hanna, and then we'll have Kathy Ashby, and then Annette Lerma will provide an opportunity. I want to thank Commissioner Chuck Statler for coming out on today, as well as Councilman Kyle McAllister back in the back. I see our buddy Mayor Norm Archibald in the audience. David Young wanted to be here on today but couldn't, but he sends in the real workers in his stead, and so thank you for being here on today. About 20 minutes ago, I sounded an emergency declaration that will limit gatherings in our community to 250 or more. Some will say this is not aggressive enough. You may have heard the President's press conference a few hours ago that urges us to go 10 or less, and the CDC that talks about 50 or less. After conferring with Doug Peters, Northern Private Sector, because 7 out of 10 jobs in our community are tied to the service industry, we thought this would cripple our local economy. Having said that, we will have an opportunity, if needed, to make a modification. I also want to communicate again that thus far there are no reported cases in Taylor County as of yet. And by the way, we will have questions towards the end. I'm sure you will have them. I want to communicate what we're doing in regards to the declaration that I signed a few minutes ago. We define community gathering as any indoor or outdoor event convening. For clarity, this includes but not limited to weddings, religious gatherings, parties, funerals, sporting events, social events, conferences, music, and art festivals, livestock events, rodeos, and other large gatherings. I did confer with some of our large congregations in the community: Beltway, First Baptist, the Hillcrest Church of Christ, Odom Lane, Southern Hills, Highland, Pioneer Baptist, to be sure that not only they understood any input, and I think all of them are in agreement in regards to how we're proceeding. An outdoor community gathering on this order is limited to events in confined outdoor spaces, which means an outdoor space that is enclosed by a fence, a physical barrier, or other structure, and where the people are present that are within an arm's length of another. The following spaces do not constitute a community gathering: office space or residential buildings, grocery stores, shopping malls, or other retail establishments with large numbers of people that may be present, but it is unusual for them to be within arm's length of each other. Also prohibited are hospitals and medical office and facilities. So again, and I appreciate so much the work of the President and the Governor and the CDC, but we're not going to limit at this time to 10 persons or less, nor 50. Our mark is 250. If need be, we can make modifications. This certainly will have an effect on our community. Kathy Ashby will talk about this in a bit. She's conferred with the school district. I believe that they made an announcement earlier today about 8 different locations where our children, we know that in the Abilene School District that almost 3/4 of all of our students are on free or reduced lunch. And many of those families rely on those meals, and so it will be made available in those 8 different locations. And Kathy, as well as United Way, Katie Alfred, are looking towards other opportunities because this will affect the retail sector. We anticipate that there will be some families that will need assistance. So both the Community Foundation of Abilene as well as United Way have created funds that will allow us, you, me, to give to our neighbors to address the shortfall these families may have. And Kathy will speak more about that in a bit. I have spoken to mayors of West Texas, Mayor Turner of Odessa, who is likely to approve a similar declaration on tomorrow. Also spoke with Ginger Nelson, Mayor of Amarillo. They're going to urge their community to go by the CDC guidelines of 50. As we speak, I believe Lubbock is gathering today at 5 p.m. to also consider a restriction. Again, what we talked about on Friday is that we do not want to cause panic, but we do want to be prepared. There's not been much sleep in the last few days contemplating what it may look like for our community. I want you, our neighbors, to feel confident that our stakeholders, our public CEOs, which are superintendents, our city manager, and our nonprofit community, are working towards an opportunity to address this in a way where we're responsible, but we're also being mindful of the needs of our community. I'm going to let Judge Bowles, and we met this morning along with Commissioner Stadler. He also wants to provide some information. I see Rochelle Johnson, the audience, also appreciate you and the action your board took on this afternoon. Judge Downing-Bowles.
Thank you very much, Mr. Mayor. And once again, it's nice to be in front of you this afternoon. And I want to just take a moment and let you know and assure everyone that we are working together, all of us. And if you see some folks looking tired, it's because they're tired, okay? But I can tell you that we're a great community, and we come together, not just Abilene, but all the other communities that exist in Taylor County. We've got roughly about 13 other municipalities out there that we deal with. I've been on the phone with school administrators today who are not in independent school districts, who are going, what kind of order are you going to give us if we need one? And so we've been working on that today at the county. So we've been working with some of the existing county programs, the jail specifically today. We're also, of course, trying to conduct court operations as well. So I wanted to take a moment and address all of those things if I could. The county is open for business, and I want to go ahead and remind you of that. What we have asked people to do, though, is if you don't have a pressing need to come to the county, don't come to the county. It puts our employees at risk. It also puts the public at risk when they get out and start traveling around and circulating around as well. So we don't want to see anybody exposed unnecessarily to this coronavirus. When you get to the courthouse, you're going to find a note on the window or on the door, a sign on the door that will tell you before you come in, if you are sick, don't come in. Okay? It will tell you that you might be asked about that as you come through security. And again, if you don't have to be there, don't be there. Take a couple of weeks and push off any activities you need to do unless it's absolutely necessary. I can tell you that we have spent part of the day today reconfiguring different ways of handling court business. We're going to, for example, allow some of our hookups we have with the jail or telecommunications facilities, use those cameras and things such as that for purposes of conducting these hearings that we need to that are time sensitive in a way that can be done so without exposing anybody unduly or unnecessarily. I do mental health hearings, and we do those by closed circuit television. We'll continue to do those by closed circuit television, but instead of having the attorney who represents the person who's the subject of the hearing, instead of having him go out there and be there in the room with the person usually it's in a mental health facility, they don't want people from the outside coming in to protect the people on the inside of the facility, and the people who are on the outside don't want to certainly expose them to that risk. So what we'll be doing is allowing those attorneys to come to the county and using our closed circuit system to meet with their clients, and then afterwards, as we have our hearings and continue to have our hearings, again, these are time sensitive. They have to take place within a certain number of days and hours. So we'll continue to do that and allow us to continue to do the court operations as we need to do so. Jury selection was called off this morning. Over the weekend, they decided they got the cases disposed of without the necessary of calling in and paneling a jury. They're going to continue to work in that regard, but we want to stress and remind people that there may be a necessity sometimes to have a jury called. If this virus gets out of control in our community, there's in all likelihood going to be a possibility of quarantine. And if that has to happen, it goes through a legal process. It may be necessary to call a jury to call into a district court who would make that determination about whether that quarantine would take place or not. So that said, it may be necessary to call a jury. And if that's the case, then you'll be notified of that. But we're just encouraging people, before you come to the courthouse, call. You know, if you can do it without coming to the courthouse, you want to wait a couple of weeks, that's what we're asking folks to do, because we really don't see it out further than about 2 or 3 weeks. We don't know what's coming after that. So we'll address that as we get closer to it. At the jail, we do not allow visitation presently at the jail, nor will we do that for the foreseeable future until we get a little bit better handle on this. Folks wanting to come to the jail and visit people who are in the jail, we understand that, but again, it places not only the jail staff at risk, but it places the inmates at risk as well at the jail. So for the present time, there's no visitation allowed at the Taylor County Jail. Let's see if there's anything else. I guess the last thing I'd really say to you is this, that we know this is new territory for a lot of us. We weren't alive back in 1918 when the flu pandemic hit around the world. A lot of us have never been exposed to anything like this before, but it is serious business, and it is something we take seriously, and I want you to know that we are continuing to work together as your government at all levels of government, from the federal government to the state government to the county and the local governments. Don't hesitate to pick up your telephone and call us if you have a problem, because we want to hear from you. But the second thing is don't panic about this. It's under control, as much as it can be under control. We will continue to monitor it and follow it, and as the need arises, as you heard the mayor say, we'll take steps and make those changes as we need to do so. Mr. Hanna, I think you're next.
Judge. Good afternoon. I'd like to update the community on the local actions the city is taking in recognition of the mayor's local disaster declaration. First, I'll just remind everybody this action makes this a criminal offense to hold a gathering of 250 people or more. So please be mindful that as we try to determine how spring break travel may have impacted our community, a measured step like this will serve to better monitor and respond to any concerns that may develop. The disaster declaration will be effective for the next 7 days, and in truth, I can promise you we'll have another round of that, so you're probably looking at least 14 days at a minimum. Future declaration renewals will be dependent upon conditions on the ground and will be made in consultation with our medical community. I want to reiterate that there are no confirmed cases of COVID-19 in Abilene, Taylor, or Jones County at this point in time, so there's no cause to panic. This is all actions we're taking out of an abundance of caution to make sure that our community remains healthy. So the following municipal services are changing. Effective March 18th through the end of April, all convention center events are closed. The convention center will resume normal operations on May 1st of 2020, and those patrons who have made deposits for their events will receive a refund for payments received to date. The Abilene Zoo is closed through the end of April, effective March 17th, that's tomorrow. The Abilene Zoo will resume normal operations on May 1st, and during this temporary closing, we'll continue to monitor the situation. If we can relax these restrictions by introducing limited hours of operation or limited access to zoo amenities, we will do that. The Abilene Public Library System hours of operation are restricted to 10 a.m. to 6 p.m. Monday through Saturday for all branches. They will be closed on Sunday. This is effective March 17th, again tomorrow. Through the end of April, normal operational hours will begin on May 1st. Again, depending on the conditions present, as this thing continues to evolve, additional library restrictions may be considered. The Senior Center will close effective March 18th, that's Wednesday, through the end of April. We'll resume operations normally on May 1st. During this temporary closure, seniors 60 and over may come to the Rose Senior Center during the hours of 11 a.m. to 1 p.m. Monday through Friday for a drive-through meal. You'll be limited to 2 meals per car, and that will be strictly enforced. Recreation centers will also be closed effective March 18th. They will reopen again on May 1st. During this temporary closure, the city will offer daycare services for city employees and city first responders on a first-come, first-served basis. In the event additional capacity is available, the city will work with our United Way community partner to identify eligible families. Child care services will be limited to ages 6 to 13 years old, from hours of operation from 7:30 to 5:30. Folks, some of you may be wondering why just city personnel, and the answer is the firemen and the police officers and the firewomen and that have to respond from a first responder standpoint have kids and school's out, so they have to wonder where they're going to put their children. Many of us are going to ask that question ourselves. We have the ability to do this. From a public health standpoint, I think it's the right idea and the right move to close our rec centers. I want to make sure that our first responders and our other city personnel are available to meet the community's expectations for service without having to worry about where their child will go. Park and recreation rentals for all buildings and parks are canceled effective immediately. We'll resume normal operations on the 1st of May. All cancellations will be fully refunded. Recreation leagues may be canceled. We're having discussions right now with the recreational league program administrators. We'll probably have an announcement for you tomorrow on that. Adaptive recreation is closed effective March 18th. Normal operations will resume May 1. Current adaptive recreation program participants may receive a drive-through meal from 11 to 1, Monday through Friday, at the Rose Senior Center. 2 meals per car strictly enforced. Splash pads in the Adventure Cove will remain closed the duration of this time. They won't even open up. Safety City will close effective immediately, remain closed to the end of May. All public tours of city facilities are canceled effective immediately. Proclamations, presentations, school-aged children pledgers, awards and recognitions at council meetings are all canceled until further notice. This is a fluid situation, and our goal in these restrictions and cancellations is to flatten the curve of infection so as not to overwhelm our medical systems in the event of an outbreak of COVID-19 in our community. Again, there are no current confirmed cases of COVID-19. Everything we are doing today is designed to help limit opportunities for community infection. There is no cause for panic. These are prudent and precautionary measures being taken by many communities across our country. And by inconveniencing ourselves a little bit now, we may avert a true health crisis in our community. Thank you. Annette, do you want to come up and comment?
So I'll speak from the public health side. We've all heard the saying that an ounce of prevention is worth a pound of cure, and I'm sure that most of us agree with that. So I'd like to address the public health prevention measures being implemented in our community to flatten the curve of this pandemic. So if you're on any social media platform, you've probably seen the phrase, but you may not fully understand what our goal is when we say that. In order to slow the spread of a virus, we need everyone to do their part to prevent the virus so that the virus does not spread rapidly through our population, as we've already seen happen in other parts of the world. The reason this is important is because if we have too many people getting sick and needing medical attention at one time, the hospitals and doctors' offices will be too full to take care of patients who are sick enough to need a medical intervention, which can increase the fatality rate. If we slow down the spread of the virus, the cases won't pop up all at once and can be spread out over a longer period of time and make caring for them more manageable. As was shown in the flu pandemic of 1918, the faster a community implemented social distancing measures, the more lives were able to be saved. In meeting with our local hospitals, they say that on any given day, they are at 90 to 95% capacity already. This is before we've even identified the first case of COVID-19. As you can imagine, it would not take very much to get to the point of overwhelming our healthcare system. I also want to stress that it's important that we do not see this time as an opportunity to travel or take the kids to go do fun things out in the community where lots of other people are gathering, such as arcades or play places. If we do that, it makes the closure of schools and canceling large events much less effective at flattening the curve. We are urging residents to practice social distancing. What does that mean? Ideally, you should stay about 6 feet away from others when you have to be out. If you're at the grocery store, stand farther apart. If you have to attend a meeting at a workplace, put your chairs about 6 feet apart, and do everything you can to place enough space between you and others so that if they sneeze or cough, there is less potential for becoming infected. The best time to implement all of these preventative measures is early in the onset and not waiting to react after cases have been identified in the community. There may be some who criticize the decisions because they make life more inconvenient, but they are absolutely necessary. If we don't want to end up in the same situation as Italy or Spain or China or all the other places that you're reading about in the news. And those other nations are reporting mass casualties and widespread disease. I also want to try and address some of the questions we're hearing about testing and hopefully alleviate some of the confusion. The main thing to keep in mind is that the test kits are extremely limited. Although private labs are coming on board, they are still limiting the number of test kits to each collection site to no more than 5 per day. So that means that if you have 5 and you did 3 tests, they're only going to replace those 3, so you have 5 at any one given time. There's a screening process to determine if you meet the criteria for testing. If you are someone who has recently traveled to an area with community spread, but you do not have any symptoms, you are asked to isolate yourself at home for 14 days after the last day of exposure and monitor yourself for a fever, cough, shortness of breath. If you are not having any symptoms, you will not be tested. There are 2 different paths for testing. You can either go through the public health department or you can go through your primary care doctor or your hospital. You must call ahead to be screened over the phone. Please do not show up at your doctor's office to request the testing, and only go to the ER if it is a medical emergency and you are currently sick enough to require emergency care. Ideally, you still need to call ahead of time. We are continuing to monitor and test the residents who fit into one of the defined risk categories. Those categories for meeting public health testing are as follows. Someone who has symptoms of COVID-19 with no other explanation of illness. Someone who is having symptoms and who also has had close contact with a confirmed COVID-19 case. Someone who has traveled to a high-risk area and has fever and symptoms. Someone who is at risk of poor health outcomes, that can be the medically compromised, the pregnant, or the elderly, and also has fever and symptoms. And someone who is hospitalized with no other explanation for illness. If you have any questions about testing, you can either call us at the health department or you can call your healthcare provider. We are all in this together. We're doing everything that we can to look out for your safety, but please partner with us in practicing social distancing.
Good afternoon. As the big country faces the challenges of the COVID-19 virus, the conversation starts with how do we take care of ourselves and moves quickly to how do we take care of each other. With people's health at risk and our day-to-day activities changing rapidly, we know that there are economic implications for so many of our neighbors who work in small businesses and service industries and for those who live paycheck to paycheck. This shows in our local 211 Texas the Call for Help activity. The 211s around the state saw an increase of 50% over the weekend, and that increase continues today. 211 is a great source for information on the latest in resources and help. When you call 211, you're going to pick your language. If you have a specific question about COVID-19, you're going to enter the number 6 and you will receive information on your health questions about COVID-19. 19, oh my goodness. Since Friday, United Way of Abilene, along with a group of educational, nonprofit, civic, and business leaders, joined together in an incredible example of just how we can take care of each other. In addition to ensuring the care of our community through coordinating services provided by nonprofit agencies across the city, we have also launched Abilene United, a COVID-19 response fund. This will rapidly deploy resources to community-based organizations, getting dollars to where they're needed most. I can tell you that this is the last thing that we wanted to do, is to have a fundraiser at this time, but our calls from 211 indicate that we do have families in need, and they're in need right now. Donors can give by texting Abilene United to 41444 to receive a link to secure giving platform, or visit our website for additional updates on ways to give and volunteer. United Way of Abilene knows that far too many people in the big country live just a missed paycheck away from real hardship. This funding will be directed to nonprofits in the community who work with families who are in need of food, rental and housing assistance, child care, and utility assistance. Our heritage of helping families in the big country since 1956 continues today with this fund. We are here for you, and we pray for peace and good health for you and your families.
I may mention, give names. I know Ms. Sims is with us, as well as Ms. Munoz. If the media wants to ask some questions about the school district. Again, I am so proud of our city, of our community. All the hard work that has occurred in recent days, and the opportunity to address the needs of some of our most vulnerable neighbors. Kathy made mention of the Live Fund for United Way. Also the CFA, the Community Foundation of Abilene, as CFA Abilene/Support Abilene, also has a fund for those of us who want to give to our neighbors. This is still a very fluid situation. We did not identify a number that was as aggressive as the CDC or the president's, but we may modify that. We do understand that this has implications on the service industry in our community. And so we're trying to balance both of those things. Dr. Young used a phrase on Friday I think is pretty applicable, and talked about using a metaphor of this is a airplane that we are building while we are flying it. And I think that's a great metaphor. And so understand that this may not be perfect in regards to a plan, but it is the best one we're able to put together. And with that, we're ready to receive any questions you may have of any of us. Are there any questions?
Yeah, Mr. Hanna, you say there is a disaster declaration for 7 days. Is that different than the declaration that was signed by the mayor for the gatherings being no more than 250?
It's the same thing. It's a local disaster declaration.
Okay, so it's the same meaning.
Same thing.
And so 7 days or 14 days?
7 days, we'll renew it likely for a second 7-day period and then reevaluate everything. So probably 14 days total.
All right. May I ask Annette?
You bet. You bet.
Hi, Annette. Sorry to put you on the hot seat again. So what is the status right now of people here in Abilene and even in Taylor County that are self-quarantined? Are there still people that are still self-quarantined, either, same question as Friday, in a home setting or in a hospital setting?
So all the ones that we're aware of they're quarantined in their own home. Some of them have not necessarily reported to us. We've just heard that groups are returning from high-risk areas and they're choosing to quarantine themselves. There's no direction that they must contact us, but we're asking if they do need some assistance or some guidance in determining whether they need to quarantine. They're welcome to call the health department. But there are several throughout the community that we're monitoring, but then there are other people that we're hearing of that are quarantining themselves and monitoring themselves because they are working to keep the community safe.
And you can't give a number, right? Or do you have?
No, we're not releasing a number.
And last question, emergency rooms, are they being overwhelmed with people who want to be tested. You said that you suggest that there's two places that people go if they want to be tested, that being the public health department or their primary care physician.
So if somebody wants to be tested, we want them to call us. Or we want them, ideally, if they've got a primary health care doctor, we want them to call their doctor first to get screened. And that clinician is going to go through an assessment with them, and they're going to decide whether they think they need to be tested. They can also call us, and we have a little bit stricter criteria that we have to follow.
Okay. Are emergency rooms being overwhelmed at the hospitals here that you know of?
So in the conversations that I have had with our local hospitals, at this point, they're kind of routine. Now they are getting more requests to test, but as far as the number that they're getting, I do not know that.
Okay, thank you.
I have one question, if that's all right, for whoever cares to field this one. I understand that our reasoning behind keeping it the limit at 250 is just because we don't see anything here yet, but I guess I'm curious, would it not be wiser to err on the side of caution right now and go with the CDC guidelines, or?
Well, we talked about balancing, and so we've been in constant contact with the private sector. 7 out of 10 jobs in this community are tied to the service industry. And so we do want to be cautious, but at the same time, we don't want to cripple our economy and put at risk those who are most vulnerable. Having said that, if we need to modify and go to 50, the president suggested 10, we'll make needed modification. But at this time, we feel comfortable that we are being responsible at the number being a 250. Any more questions?
I kind of want to follow up on that. Why? I guess that logic doesn't make any sense to me, because, Mr. Henry, you're talking about closing services, closing the zoo, closing some things. Is the expectation that this disease is coming our way?
So I think we'd be foolish to assume we're never going to have a COVID-19 case in Abilene, Texas. We have an airport, we have an air base, we have children that have traveled the world and are coming home from spring break. But we don't have a positive case right now. And so setting a number of 10 or more from a social gathering standpoint, I think is probably an overreaction on our part. We are trying to make a measured response to make sure that we can help flatten the curve so that we don't inundate our hospital and medical community with cases. Which is exactly what's happened in France, in Italy, and Spain may be heading that direction too. And so we're trying to be proactive on the front end of this thing to do what we can. It is a measured approach. If we need to lower the number to 50 or 2, we'll do it tomorrow. This is not something that requires a lot of fancy footwork on our part. It requires the mayor to sign a document that says this is what we're doing, and we do it. So as I said at the first press conference, we will take swift and decisive action to protect the community's health if we see the need to do it.
And there's talk of no confirmed cases, but you guys said you're allowed 5 test kits per location. Is that enough to identify that there's no confirmed cases, or is that just? So
no. If you meet their criteria to receive a test, you will receive a test, right? One of the challenges of something like this is that people are afraid, and so they may decide, I think I was exposed. I walked around to the airport, or whatever. I feel sick. I need a test. So there are not enough tests to handle that load of people, right, who feel like they may just want a test. This is why we have testing criteria. Once that testing criteria has been met, the test is administered, it goes through the public health process, and the results come back. I think that right now things are about as orderly as they possibly can be. Is it possible that we have a COVID-19 person out there right now. I can't tell you that we don't. I mean, if I did, I'd be lying to you. But I'm fairly certain with the system that's in place in the United States and the measures that we're taking today that we have about as good of an opportunity to get in front of this virus and see the effects in our community be a lot more positive than they've been in other places around the world.
Can I clarify one thing about
Sure you can.
So just a clarification about the 5 tests, that is per site. So we can get 5. Any other healthcare provider that decides they want to do collection, they can get 5 through their contracted lab. So is it enough to test an entire community to see if we truly have COVID here? No. But we're limited by the number of tests that we're able to get. So if in public health, if I had my way, I'd have a lot more tests and I'd, reduce the restrictions and start testing more. But that is just a limitation of the number of tests that are available.
How many organizations, places in Abilene have tests right now?
That I do not know, because it's up to each individual provider to request the test, or not the test, but the collection kits, so they can send it away to a lab. So that would be up to each individual provider, and they don't have to report that test.
And I have one more unrelated question. Mr. Mayor,
Before we move on to the next question, I also want to clarify some stuff on this testing thing, just to reiterate some things. We are taking the precautions we're taking, right, to minimize the impact. Let's not forget some of the first things we said on the first press conference. If you feel like you're sick, stay home, right? Stay home. Don't go to the grocery store. Don't go to the pharmacy. Stay home and help your neighbor out by doing those simple things. And if we just are a little more community-minded about some of this stuff, I think we can make some good headways into fighting this disease. Thanks, Jill.
I want to add to that. So we got here based on our conversation with healthcare professionals in this community. There is no other currently West Texas community that has any sort of mandate. We made a decision early on through the weekend that we would. The revelations this afternoon with the President and CDC on yesterday, we are ready to make needed modifications if we need to. There has not been a day in the last several weeks where Annette or Team Abilene has not been focusing on what we should in response. And so I think that we've acted very appropriately in trying to be sure we put at the forefront the health and welfare of this community. Do you have another question, sir?
I do have one more question.
Okay.
I'm just wondering how much communication you've had with state lawmakers, Stan Lambert, there are people that have been involved.
Stan Lambert and I have spoken about 4 or 5 times today. And so we're in constant communication with our representative. We're also, and I can't just thank Jody Arrington enough, our congressman. We text even on yesterday. And so there are constant conversations, not just with me, but Annette and others every single day, multiple times a day, so we can respond in a way that's appropriate for this community.
How much input did they have on helping you come to the decision as a community?
Their input, as well as our healthcare professionals in this community, are what we use to come up with a decision that we have made at this time. And again, I remind you that currently, there is no other West Texas community that has made any sort of threshold. Abilene has led the way, and if need be, again, we'll modify. Any further questions from anyone? Thank you for your time, and again, I'm just so appreciative of this community, how we rally around for the betterment of our citizens. Thank you, and you have a great evening.